Pharmacology is the study of drugs and their interactions with living systems. It covers how drugs are absorbed, distributed, metabolized, and excreted, known as ADME. Understanding pharmacology is crucial for assessing the therapeutic benefits and risks of medications, ensuring safe and effective care. Key concepts include pharmacokinetics and pharmacodynamics. Drug classifications include ACE inhibitors, which reduce blood pressure by inhibiting angiotensin conversion. Beta blockers decrease heart rate and blood pressure by blocking beta receptors. Diuretics increase urine production to reduce fluid. Opioids bind to receptors to relieve pain, and antibiotics kill or inhibit bacterial growth. Mechanisms of action include enzyme inhibition, where drugs like ACE inhibitors block enzyme activity. Receptor binding, as seen with opioids, relieves pain. Hormone replacement, such as levothyroxine, addresses hypothyroidism. Bronchodilation with albuterol opens airways, and blood thinners like warfarin reduce clotting. Pharmacokinetics, or ADME, involves absorption, distribution, metabolism, and excretion of drugs. Absorption is the drug entering the bloodstream. Distribution spreads the drug to tissues. Metabolism involves liver enzymes, modifying drugs. Excretion removes drugs via kidneys. Factors affecting ADME include liver and kidney function, age, and health. Pharmacodynamics focuses on the dose-response relationship, where effect increases with dose. Agonists activate receptors, while antagonists block them. Potency refers to the dose required, and efficacy to the maximal effect. The therapeutic index is the ratio between effective and toxic doses, crucial for safe medication use. Routes of administration include oral, which is convenient but slower due to digestion. Intravenous offers fast onset and complete bioavailability. Intramuscular provides moderate onset, often used for vaccines. Subcutaneous is slower than IM, common for insulin. Topical treatments are localized, like creams or patches. Adverse effects and toxicity include side effects like drowsiness or nausea. Severe adverse effects can lead to liver failure or hypotension. Toxicity results from overdose or accumulation, such as acetaminophen hepatotoxicity. Monitoring is essential to prevent and manage these effects, ensuring patient safety. Drug interactions can be synergistic, where combined effects exceed individual ones, like alcohol with sedatives. Antagonistic interactions reduce effects, such as naloxone with opioids. Metabolic interactions affect enzyme activity, and food-drug interactions alter absorption. Monitoring and education are vital to prevent dangerous interactions. Nursing considerations include patient education on medications and side effects. Monitoring involves assessing vital signs, lab values, and symptoms. Documentation ensures accurate records of administration and effects. Advocacy focuses on patient safety, while collaboration with providers helps adjust therapy as needed. In this clinical scenario, a 55-year-old patient on metoprolol, warfarin, and an antibiotic reports fatigue and dizziness. The nurse notes a slow heart rate and bruising. Critical thinking questions explore potential causes, nursing assessments, patient education, liver function monitoring, and addressing bruising related to warfarin therapy. Dizziness and fatigue may result from metoprolol and warfarin. Metoprolol lowers heart rate and blood pressure, causing dizziness. Warfarin can lead to bruising and fatigue if bleeding occurs. Priority nursing assessments include monitoring blood pressure, heart rate, signs of bleeding, and mental status to detect adverse effects early. Home management education involves teaching patients about low blood pressure signs, bleeding symptoms, and taking metoprolol as prescribed. Reporting abnormal bleeding is crucial. Monitoring liver function prevents drug accumulation and toxicity, ensuring safe medication use, especially with multiple medications. Addressing bruising involves assessing bruising, checking INR levels, and reporting excessive bruising. Monitoring INR is essential for maintaining safe anticoagulation therapy. This ensures therapeutic levels for warfarin and identifies bleeding risks, promoting patient safety and effective treatment management. A multiple-choice question asks which nursing assessment is a priority for a patient on metoprolol for hypertension. The correct answer is monitoring blood pressure and heart rate, as metoprolol can lower these vital signs. This monitoring is essential to ensure patient safety and effective management of hypertension. A question about drug administration routes asks which statement is correct. The correct answer is that intravenous administration provides complete bioavailability. IV administration bypasses absorption barriers, delivering 100% bioavailability directly into the bloodstream, making it the fastest and most efficient route. The rationale for IV administration's complete bioavailability is that it bypasses absorption barriers, delivering drugs directly into the bloodstream. Bioavailability refers to the amount of drug reaching the bloodstream ready to work. IV medications achieve 100% bioavailability, unlike oral medications, which lose some during digestion. A patient on warfarin with increased bruising should have their INR levels assessed first. INR monitoring is critical for assessing therapeutic levels and identifying bleeding risks. This ensures safe anticoagulation therapy and helps manage potential complications associated with warfarin use. For a patient taking metoprolol and insulin, the nurse should educate them to monitor for hypoglycemia symptoms. Beta blockers like metoprolol can mask these symptoms, so patients must closely monitor blood sugar. This education is vital for preventing complications and ensuring effective diabetes management. A question asks which drug classification is likely to cause electrolyte imbalance. The correct answer is diuretics, as they increase urine output, leading to the loss of electrolytes like potassium and sodium. Understanding this side effect is crucial for managing patient care and preventing complications.